Unong ilam kaliang pyrshah ubolong ru umentirang ba barim kejalau Dr. Mukul sangma harengkat ka kenhun ki MLA ke bana kaliang pyrshah ha kalai terik lahiyar banle jurep ya artli ki caka sumar ki badan Haribhoi district ka MCH ka badan ha umran bat kanong po Civil Hospital. U Dr. Mukul lalai ban jurep yakni ki caka sumar harengkat ke jinsan lang ka Deputy Commissioner ka Haribhoi district ka Kongru Set Mary Kurba bat u Director of Health Services MI Dr. Amanwar bat ka jinong lang ki he Dr. Jong ka Haribhoi district. Kelam ke jingan tho iki doktor bat kinong tri ki bah khmat jong kana koi kakhia u Dr. Mukul na ka jinglap ko jungu ha ka jingle jurep ulong bau dap da ka jingsong si banyu I ya ka jing bompat biang ki caka sumar ki ba pniai da ka sorkar jala bat banyu I ya ka jingduna jong ka jingdon ki tiar a jing sumar ki nong pang COVID-19 na kaliang Dr. Mukul long kani kelapan pau ba ka jala kampat long ka kelapan kre banyu kun persya ka kelam COVID-19 ha kani ka jingle jurep u Dr. Mukul lalap ba ka jingdon ki oksigen hanong po Civil Hospital kampat biang namar lada kibron kam hok iki tang da laingut ki nongpang ki oxygen baro ki lalun.
I am very sad to see that other than Civil Hospital Shillong, none of the hospitals in the state can actually save the lives of the patients if they develop to more critical condition requiring ICU intervention. Number one, there is no manpower. So though we have the ventilators, though we have the ICU, they cannot be operationalized to save lives. We are very unfortunate to see that we have not been able to be ready. Doctors are here, they are trying their best. I can see the frustration amongst the frontline workers, because what is more frustrating to the frontline workers than seeing their patient succumbing? If they see fatality rate going up, it will obviously have toll on the frontline workers. They'll have real problem of stress and strain. And this is because the facility available, notwithstanding the manpower backup, there should have been people who can operate the ventilators. There should have been manpower put in place who could operate the ICUs to save lives whenever there is a critical case. But this is not happening. This has not yet happened. You cannot expect patients from Nongpo to be shifted to Shillong for further intervention when you're talking about saving a patient which has gone to a critical condition. So these are things which we have discussed. We will articulate them accordingly. The HODs are here. The DCs are now able to understand what are the deficiencies which are identified now, how we can actually ensure that these deficiencies are addressed at the earliest and save lives. Today we have visited that MCH hospital in Umran. The work is still on. Hopefully they should expedite the whole process of this further finishing work of the infrastructure. But as of now, it's not operational. The only facility which is available in Haribhoi district is only this civil hospital in as far as treatment for the COVID patients are concerned. Now, after having seen and after having collected all the inputs here pertaining to the facilities available here, including the manpower, see, the facility available here is not enough to save lives. If these facilities would have been ramped up, including the manpower, we could have saved more lives. We have been, from the day one after seeing the death count, we have been very, very concerned about the very alarming number of death count. If you look at the percentage, the proportion between the positive cases, new cases on a daily basis, and the death count, it has been always on a higher side. 2.5% to 3% it went around, which is very, very high. Therefore, it was necessary for us to find out what exactly is the reason. There are a number of factors. One part is that the home isolation part and the delay in decision of the patient to actually shift the patient who require immediate hospitalization, the duration, the decisiveness in transferring the patient to a hospital. whatever has been done and whatever is being done, whether they are enough. Even now here, if you look at the oxygen plant which is being installed, hopefully it will be done by another 3 days, 4 days. That's what is the indication given by the superintendent of the civil hospital. But the fact is that if you have patients who, based on the progression of the case, require more critical care, then what is going to happen? Just 3 patients will consume all the oxygen here. You get my point now? This is the technical aspect. Just 3 patients can consume the whole oxygen. So what happens? Are we really prepared? No, we are not. That's why this is just an initial probably intervention, but then we have to ramp up. You got my point. Only 3 patients will be able to be catered by this quantum of oxygen. Similar situation in other hospitals also, so that everything else fall in line. We have to be very cautious because second wave is showing sign of flattening. But there are inputs to indicate that cases in the rural areas are increasing. Now, the number of positive cases on a daily basis may not be the correct picture, because only if those likely positive cases in the rural areas are coming forth to get themselves tested, then only we will actually know the real picture, the real number of incidents. But in absence of that, we will always have a figure which is quite a deviation from the correct picture. And therefore, any likelihood of the third wave, we must be very, very cautious about them. We must ensure that we are able to prevent the severity of next wave, or if possible, prevent the next wave altogether. But even if we cannot prevent, we must be able to prevent severity of next wave so that we don't end up losing precious life.